Hello, I'm a family nurse practitioner student and I'm here to take care of you. Can you tell me why you're in here?
I'm here to get my eyes, nose, ears, and mouth and neck checked.
Okay, good. So before I start, can you just tell me your full name and date of birth?
Felipe Ramirez, 1 May 1989.
All right, I'm just going to be recording this. Do I have consent from you?
Yes.
We're going to be recording on this. All right, so I'm going to start off with your head. I'm going to go down to your eyes, then your ears, your nose, your mouth, your throat, and then your neck. I'm going to start off with your head. I'm looking for symmetry. I'm trying to see if there's any signs of trauma, any lesions that I might be able to see. I'm looking at hair distribution. Do you have any patches in your head? I'm looking at the texture. Um, and I'm also gonna assess for any rashes that you might have. Have you had any problems
No.
with your head? Okay. I'm looking at the shape. It looks round. Now, may I palpate? Okay.
Yes.
So I'm palpating for any cysts, any lesions, depressions, hematomas, cysts, and I don't see any. Looks symmetrical. Next, I'm going to assess your visual acuity with the Snellen chart. The way it works, you're going to cover one eye, and then from 6 feet away, I'm going to have you read the third line, and we're going to go down. We're going to do it on each eye, and then we're going to do it on both eyes, okay?
Mm-hmm. That'll be EPTZO, CFDHJ, LTFPH.
Okay, good. So your right eye is visual acuity of 20/20. Now we're going to do the other eye.
EPTZO, CFDHJ, LTFPH.
All right, so you have visual acuity on the left eye as 20/20 as well. So now I'm going to have you read bilaterally.
EPTZO, CFDHJ, LTFPH.
All right, good. So your visual acuity is 20/20. Next, I'm going to assess the eyes. I'm looking for any exophthalmos. So someone with hyperthyroid would have issues, would have bulging eyes. Or I'm also looking for ptosis, eyelid drooping. I don't see any of that. If you can look at the camera, thank you. I don't see any deviations. Next, I'm going to look at your conjunctiva. So at the lower lids, it should be pink, and at the sclera, it looks white. So that looks good. Next, I'm going to assess your lacrimal system. I don't see excessive tearing, and I don't see any swelling, redness in his lacrimal ducts. Good. Next, I'm going to assess the sclera, and the sclera looks white around it. I don't see any jaundice, no yellowing. I'm looking at the iris. The iris looks brown. Okay. And I'm looking at the cornea as well. Or cornea looks clear. Good. Now I'm going to assess how your pupils react to light. So I'm going to do direct light and consensual. So as I apply the light at your eye, the other eye should consensually constrict as well. And I'm going to be assessing this on both eyes. All right, so I'm going to apply the light. And the pupil looks like about a 4. It's reacting to light, direct light. As I apply light to the left eye, the right eye is also constricting. They're about a 4 millimeters, and when I apply light, it turns into a 2. So now I'm going to do the other eye, the right eye, and it's also reacting to light. So pupils are equally around, react to light, and when they constrict, they turn about 2 millimeters. Next, I'm going to assess for extraocular movements. So this involves your cranial nerves 3, 4, and 6, the oculomotor, which is just going to be the movements, the other ones. Trochlear, it's down and middle, and abducens, which is linear. Um, and while I'm doing this, I'm assessing to see if there's any nystagmus, if the eyes are jerking around. So I'm gonna have you follow, and I'm also gonna assess while I'm already here. I'm gonna assess for convergence. So I'm gonna have him, or I'll do that one next. But we're gonna start off with following my finger, and we're assessing extraocular movement. So follow my finger up and down. Okay. So I don't see any signs of nystagmus. Next, I'm gonna assess uh, convergence. So that I'm gonna see if how if his eyes are able to come in between, and if he has double vision. I don't. His eyes are able to meet. Um, Next, I'm gonna assess for accommodation. So I'm gonna have you look at from afar. You're gonna look at the picture, and then you're gonna come into. You're gonna look at my finger, and I'm assessing to see if his eyes are able to accommodate. All right. So look from far. Now look at my finger. Good. Now look, go back, and I see pupils constrict. Okay. Now look at my finger. Good. All right. Now I'm gonna assess visual fields through confrontation. I'm gonna cover my eye, and we're gonna cover the same eye. So you're gonna cover, yep, just like that. So we have the same visual field, and I'm gonna do it on all 6 visual fields. Ready? Tell me when you see my finger.
I see it. 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 I see it.
Okay.
I see it.
Okay, good. Now we're gonna do the other eye, and I'm just gonna. All right.
I see it. 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 I see it.
Okay, good. Now we're gonna do it with both eyes. Just look at me. Don't move your head.
I see it. I see it. I see it. I see it.
So I just did both eyes, and then I did each eye bilaterally. Now I'm gonna do a fundoscopic exam, and I'm gonna dim the lights, so if you can see better now. And I'm gonna visualize. I'm gonna take a look before I go in. I'm gonna look at his cornea, make sure it's clear, and I'm looking at his lens as well. I don't see any signs of opaque. Next, I'm gonna look for the red reflex. Okay. I'm looking at the red reflex. I see it. All right. Red reflex. I'm looking at the optic disc, optic nerve. I also see the optic cup. And the cup disc ratio looks about a half of the optic disc. It looks orange, optic disc looks orange, round. The margin seems sharp. Good. I'm gonna look at that. I also noticed the vessels. I saw a venous pulsation. There's always an artery to the veins. I don't see any signs of swelling. And now I'm gonna look at your other eye. And the whole time I'm doing right eye with his right eye. Okay. So I'm gonna look for the red reflex. I see the red reflex. Good. I see the optic disc, optic nerve. Optic disc looks orange. I don't see any hematomas. I'm looking at the vessels. There's an artery to each vein. I see venous pulsation. The cup disc ratio looks about half of the optic disc, and um, it looks fundoscopic exam looks normal. I don't see uh, any issues. Next, I'm gonna start with I'm gonna do your ears. Or I can do your nose as well, so I'll do your nose. So I'm looking at the nose, I'm looking for symmetry. Does he have any, I'm trying to see if he has any polyps or any deviation, any septum deviation that I can tell. It looks symmetrical, it looks in midline, and now I'm just gonna inspect. I'm gonna also look, have you had any allergies recently? Okay, and now I'm gonna palpate. I'm gonna palpate his frontal sinuses and his maxillary sinuses. So if you can just show the camera. So are you having any pain?
No.
I don't feel any masses, any swelling. And now I'm gonna look, maxillary, right? You feel any pain?
No.
Alright, good. So now I'm going to inspect with the light. I'm going to look at the mucosa and your turbinates. These are the walls. The turbinates are the walls of the nose. I'm going to look at the superior, the medial, and the inferior. And his nasal mucosa looks nice and pink. I don't see any polyps. I don't see an obstruction. And now I'm going to look at the other nair. And throughout this, I'm going to be doing it on both sides. It looks nice and pink. I don't see any polyps. There's no redness or obstruction that I noticed. Next, I'm gonna test for airflow. So I'm gonna have you cover your nose, and then just, do you have any problems breathing?
No.
All right, now cover the other nair. So airflow is clear. Next, I'm gonna assess cranial nerve 1, which is olfactory. I'm gonna assess his smelling. So I need you to close your eyes, and then you're gonna cover one nair, and then you're gonna tell me what you smell.
Cinnamon.
Okay. Now we're gonna cover the other nair. Tell me what it is.
Coffee.
Good. So cranial nerve number 1, olfactory, is intact. Next, we're gonna start on the ears, and I'm gonna start off just with hearing. I'm gonna assess. I'm gonna whisper something, and he's gonna say what I'm whispering out loud. All right. So I'm gonna have him cover one of the ears. All right. I'm gonna whisper something. Yeah. Cover.
Ball.
Good. Now you're gonna cover.
Apple.
Okay. Whisper test is intact. He was able to say exactly what I said back. Next, I'm gonna do the Weber test, and I'm just gonna use the tuning fork, and then he's gonna tell me whether it lateralizes or if he can hear on both sides. Okay, let me just I have to hit it a little harder. And this is just assessing for conduction.
Yes.
So you hear it on both ears?
Yes.
Okay, that's a normal sign. If there was lateralization, there would be an issue. I don't see any lateralization, and that's the Weber test. Next, I'm going to do the Rin test. The Rin test, it tests for air conduction versus bone conduction. I'm gonna place this behind your mastoid bone, and then tell me when you no longer hear it.
No.
Okay, and now
Still here, yep.
you still hear it? Okay, so that would mean air conduction is greater than bone conduction, which is a good normal finding. And I'm gonna assess this on the other ear.
No.
Okay.
Yes. Still here.
Okay. Good. So air conduction is greater than bone conduction bilaterally. I'm gonna look at the ears now. I'm looking at the external side of the ear. I'm just looking at the ear. And I'm looking for any discharge, any drainage. I don't see any. It looks nice and pink. I don't see any polyps and the ear looks midline, symmetrical to his face. And I'm gonna be doing this bilaterally when I'm inspecting. But now I'm gonna start palpating his ear, the external. Are you having any pain?
No.
Okay. I'm looking to see, I'm gonna also touch the tragus. Do you have any pain right there?
No.
The pinna? So before you go in, it's good to pull the pinna up and back because if they have pain, you might refer the test. No pain?
No.
Okay. I'm gonna do the same on this ear. I'm assessing the external ear. I'm looking at the tragus. Okay, good. And no pain?
No pain.
And it looks nice and pink. Now I'm gonna assess the ear. I'm looking at the external canal and I see that it's nice and pink. I'm gonna go in and I'm gonna actually place this. So in case if he were to move, I would move with him instead of pulling it back into there. I'm gonna look for his tympanic membrane and it should be pearly gray. If it was bluish, it would mean some type of trauma, head trauma. I'm also gonna look at the cone of light. The tympanic membrane looks, let's see, looks pearly gray. See the cone of light. And the cone of light, because I'm looking at his left ear, it looks like it's at the 7 o'clock to the left eardrum. Good. Next, I'm gonna assess the same thing on his right ear. I already inspected, palpating. Now I'm gonna go in. I'm looking at his external ear. Up and back. I'm pulling the pinna up and back. Good. And I'm looking at his tympanic membrane. It looks pearly gray. The cone of light is shining at me right at the 5 o'clock to the right eardrum. Okay, next I'm gonna start with the mouth. The mouth, throat, and face. I'm gonna look at his lip color. So if you can just look that way. I'm looking at his lips. Make sure that they're moist. They look moist. They're nice and pink. I don't see any signs of cracking, any lesions, such as hepatic lesions. I don't see any of that. Next, I'm gonna look at his buccal mucosa. I'm just gonna look at the inside of his mouth. It looks nice and moist, and pink. If you can raise your tongue up. I'm looking also at his salivary duct openings. I see saliva present. I don't see any excessive saliva. I'm looking at his gingiva. So I'm looking right at his gums. I don't see any pigment, hypertrophy, or infection, or any signs of infection. People who have usually hypertrophy, or it could be people who take Dilantin, they would have hypertrophy. I'm also inspecting his teeth. I'm checking that he doesn't have any dentures. I don't see any dentures. I don't see any caries. His teeth actually look really clean, nice and white. I don't see any abscess or deformities. He has all his teeth and no extra teeth. Now I'm going to inspect his tongue. I see a small papilla present. I don't see any protrusion or I see the tongue is midline. And size, it's not big. It looks medial. Next, I'm gonna assess the strength. So because I don't have gloves here, but what you can do is push your tongue against my hand, and it looks good in strength. Now we're gonna do it on this side. And I don't see any deviation. I'm inspecting strength and deviation. This is cranial nerve number 12. I don't see any of that. Now push this side. Good. So now I'm going to have you open up your mouth. And this is assessing cranial nerve number 9 and 10. I'm going to look for the soft palate, which is back here. And can you say ah for me? Ah. Okay, I'm looking right at it. It looks nice and pink. It looks nice and pink. His palate, his uvula is it raises when he says ah. I don't see any signs of deviation. Next, I'm gonna assess the posterior pharynx, which it looks nice and pink, and I'm also assessing his tonsils. His tonsils, I don't see any abnormal findings. His tonsils are visible, and they're about a +1. Next, I'm gonna assess his neck, which I'm gonna be assessing range of motion. So now, Mr. Ramirez, can I have you flex your neck? So you're gonna flex by going down, and then you're gonna hyperextend going back. Do you have any pain? All right, so now we're gonna do a lateral movement. So you're gonna do lateral motions. You're gonna go side to side. Good. Now we're gonna do a circular motion. Do you have any pain, Mr. Ramirez?
No.
All right. Next, I'm gonna assess his accessory muscles. The first one, I'm gonna do a shoulder shrug, which assesses the trapezius muscle. So, can you push up against? Do you have any pain? Okay. It's about a +4. Good job. Next, I'm gonna assess your sternocleidomastoid muscle. I'm gonna have you push against. Yep, just like that. Push against my hand. Good. Push against my hand. Do you have any pain?
No.
Okay, good. Now I'm gonna start with palpating lymph nodes. I'm gonna assess his anterior, posterior, and I'm gonna go through. So I'm gonna start with the preauricular, so right before. And I don't feel any I don't. Do you have any tender?
No.
I don't feel any nodules. And now I'm gonna assess postauricular, and I'm assessing this with the tip of my finger. Any pain?
No.
Good. Now I'm gonna assess the anterior cervical, and I'm assessing all the way down. All right. What about now? I'm gonna assess posterior cervical. I'm gonna assess the submental, the submandibular, the supraclavicular. Good. And the occipital. Good. And I'm also, since I'm already here, I'm gonna assess his trachea. It looks like it's midline. I don't see any signs of deviation. And then I'm gonna assess his thyroid gland. And the thyroid gland, it's good to look at it from a tangential view. So you're gonna look away from direct light. And if you see any shadowing, that would be a problem, which I don't see that. Good. And now I'm gonna look at your I'm gonna palpate the gland, and we have water right here. And I'm gonna assess anterior view and posterior view. So I'm gonna I'm gonna have you swallow. Good. And the isthmus, it should just be going up and down midline, which I see. I don't see any masses, lumps. And I'm gonna come from behind. Can you scoot up a little bit? I'm gonna come up from behind. And I'm assessing his thyroid cartilage, which is above. Then I'm gonna look for his cricoid cartilage, which is right in the middle, thyroid gland, and the isthmus. So now can I have you swallow again? Any pain?
No.
Good. And everything seems midline. I don't see any lumps, bumps, masses, or any signs of deviation. This about concludes our assessment. Thank you, Mr. Ramirez.